I do want to move on to our next topic because a trip to the chiropractor may not seem like a big deal, but what if the patient is only a few days old? I want you to take a look at this. What we're seeing here is a 12-day-old baby having a chiropractic adjustment. And yeah, a lot of people are wondering exactly what they're seeing. A lot of people haven't heard about this. This is apparently becoming more commonplace. We're joined by a pediatrician, Dr. Daphna Adut. I wanted to get your thoughts on this, mainly just from the world of pediatrics. Is this something that you've heard about or your colleagues have heard about, and what's your stance on it?
Yeah, so actually, pediatric chiropractor is actually pretty new to me. But just looking at this video myself as a mother is pretty disturbing and bothersome. However, as a pediatrician, I can understand why some parents may be seeking alternative medicine methods to help their little ones. You know, we can get frustrated, helpless when we see them so sick. So taking them to another practitioner may actually, we'd be thinking that is helping them. And going in and doing these manipulations are so-called adjustments, are forceful, sudden movements that are imparted on a very small body that is just starting out their life. They're not even fully developed. Their bones are at risk of breaking. There could be neurological damage. There could be muscle spasms. And so I feel like the parents may not really fully understand the consequences of taking them to a chiropractor.
In that video, though, it looked more like just a little massage, didn't it? I mean, I was thinking that it was like a true...
I saw some that were, yeah.
Well, they're moving the pelvis there.
We actually have two chiropractors that I want to bring into the conversation. Join us via Skype, Dr. Stewart and Dr. Terry Warner, who say they adjust infants on a daily basis. And clearly this is a growing trend for parents. And my biggest curiosity, and I'll openly tell you, the minute I finish taping here, I'm going to see my chiropractor. I'm a big fan, but I have a lot of concerns with this.
It may be new to you, but chiropractors have been adjusting kids for over 100 years. And tens of millions of adjustments are safely and effectively given to children each and every year.
If you look at our malpractice rates, we pay a fraction of what other doctors pay because what we do is safe. And a good comparison to put moms at ease is if you look at the amount of force used in the average birth process, it could be upwards of 20 to 40 pounds of torsion and traction on that newborn's neck, who doesn't even have the musculature to hold their head up. And you compare that to a few ounces or a pound of carefully directed pressure in the right direction in the right time, there's no comparison. And parents today are understanding and recognizing the important role the spine and nervous system plays in that child's health and well-being.
I think the biggest issue is you're taking a 12-day-old and making adjustments, and a healthy 12-day-old baby, I don't...
What adjustment do they need?
Other than maybe parents feeling like there's a benefit, what really is the purpose?
Absolutely. The position the baby's in utero and the birth process can be very traumatic on a newborn. So it's very important to evaluate that baby to make sure everything's in alignment and moving properly, because if it's not, it'll put interference in the nervous system that can compromise that baby's ability to be well. So babies that get adjusted and we remove that nerve interference, the body can heal better, function better, and work better.
So may I say, as a board-certified OBGYN, I would not necessarily equate the delivery process to what I've seen in the videos. And I've met a lot of babies who have grown up nice and healthy without having these adjustments. So I realize that in medicine, you know, we grow and we evolve and we learn. And one day, this may be the standard of care in America. But as of today, for myself and other individuals who have concerns about this, can you direct us towards great studies that prove that this is not harmful and great studies that prove that there is some benefit? Like, is there a meta-analysis to look at this situation?
There certainly are more and more studies being done all the time, and that data continues and is showing the efficacy of chiropractic care for children. But the truth is that the proof is in the patients and the millions and millions of moms and dads who will testify as to the life-changing benefits that chiropractic has had for their family and their children. And we hear it day in and day out. In our 24 years in practice, we've seen nothing but children really benefiting from this.
So what are the potential complications?
Should a patient have something called atlantoaxial instability, that's specifically where the skull abuts with the first vertebrae, if that's unstable and you don't know that that's what the patient has, and you go ahead and do your manipulations on the neck, it's over with. Or if we have a patient that has spina bifida, where their vertebrae are not completely whole, and we do these cracks with these forceful manipulations on the body, again, we can have detrimental neurological damage that can last for the patient's lifetime.
The conditions that the doc just mentioned are things that during our history, during our exam process, we're going to be able to find that out. They will have been to their pediatrician. They are at getting treatment for those types of conditions. Adjustments for a newborn or a child, an infant, are very different than adjustments that you might be traditionally thinking about for an adult. To understand the amount of pressure that's used, if you were to take your finger and just press it on your eyeball comfortably, that's about the amount of pressure that's actually used. Or if you were to squeeze a ripe tomato and you could feel that, that's the gentle pressure that, if applied in the right place, in the right direction on the child's spine, it can vastly change and improve their health.
My words of advice, if you're considering this, make sure you get the okay from your pediatrician.
Yeah.
I will say I'm dubious. A 12-day-old baby, it just makes me personally nervous. When it comes to healthcare, it's all about getting the right care at the right time and trusting your healthcare provider. So just have good relationships with your healthcare providers. Stuart and Teresa, I want to thank you so much for sharing your perspective with us. Dr. Adu, thank you as well. Yeah. We'll be right back.